Welcome to MapleWoodian.com podcast. We have on the phone Robert Rowe, health officer for the Township of Maplewood. Mr. Rowe, how are you doing?
I'm doing good.
Great. I wanted to talk to you about a couple things. One, though, that's of interest. It's all over the news, and at times can be over-covered with scare tactics. But wanted to get your view on the whole Ebola outbreak in Africa. Now, two patients have come into the United States, although it looks like they're under great security. People start to worry, and the media starts to hype it up. What is the real concern, if any, people should have about this, or should they?
It's certainly a serious and deadly disease, and people should be aware of it. And while it's not being spread in the United States, what people need to do, particularly people involved with medicine or ambulance squad people, is to do what we call universal precautions. And those are the precautions that really became very well used when the AIDS epidemic hit. And so, you'll see all health personnel now wearing gloves, changing gloves, sometimes wearing masks for certain procedures, and just generally keeping things much more clean and sanitary than they did in the past. For example, if you go to the dentist, your dentist probably has a lot of their equipment covered with plastic, so that they can, keep it clean.
But people refer to this as the Ebola virus, but it is not something that can be spread like a common cold.
No, they're saying
it's the bodily fluids similar to HIV, or?
Yes, it is.
Or no?
Yes, that's not a bad way to look at it. It's not airborne. That's what the current information is, although, I've learned sometimes things change. But right now, the Federal Centers for Disease Control is saying it's not airborne, it's body fluids, and that could be saliva, blood, feces, urine, so it would have to be somehow you'd have to come in contact with that and ingest it or have a wound infected with it. And the fact that they have, 2 cases in the United States so far, for the average, Maplewood person who isn't in the health industry, who maybe is just, commuting into the city or traveling for summer vacation within the U.S., what should they be concerned, or should they be any more concerned than they should be with any other? Well, I don't think there's any concern if you're traveling within the United States. Right. It would be only in certain parts of Africa, if you were traveling there, that there would be concern. So any concern about, just living in this country and traveling, you're going to catch this just because the media hype is so big, people start to wonder, should they worry, and that's what we have to do. Well, I would say there's certainly no cause for worry, but you certainly should be alert and follow the situation so that if it does become more dangerous to us, we'll be prepared with what we'll need to do. I think we live in a world now where diseases are only an airplane flight away. Sure. And we saw how quickly the H1N1 flu spread about 4 or 5 years ago. And, that spread worldwide within just a few months. So viruses can travel very quickly. This one, there's potential for widespread, but it seems to be pretty well, because of the life cycle of the virus, as it were, it's not spreading beyond certain areas yet. And I think as long as we take appropriate precautions, that we should be safe. I know myself here at the health department, and I'm certain all physicians and nurses and anyone involved in medicine fields have already received alerts telling them what to look out for and how to be prepared and how to handle situations if there is suspected Ebola. But
But there hasn't been any type of alert within the U.S. or our state or even within Maplewood beyond.
No alert yet. Yeah. No, it's just, but it's just alerting us to be alert. I guess is the way. And we have multiple, in this day of the internet, we have multiple redundant ways of getting out information, and so that's all to the good. So that if something bad does happen, it can, the news about it can be spread quickly, so other people can be prepared.
And if people think they have symptoms, obviously you go to your doctor.
Right.
Or call.
If you had a relative who was from that area of Africa and they came to visit you and they became sick, they should seek medical attention right away.
But in terms of catching it from someone else, it's not something that's, like you said, airborne.
That's what they're saying. I heard a doctor from the Centers for Disease Control say if he was sitting on an airplane next to someone with Ebola, he would not be concerned because it's not spread by airborne.
Excellent. Now, you and I talked about other things. So within Maplewood, in other areas that you're looking at these days, you said this is mosquito season, and I think we had posted something after talking to you earlier, but tell folks about what the situation is with mosquitoes and how to prevent and why.
Well, mosquitoes are, they're certainly been a nuisance, and they make it difficult to enjoy your backyard at night. But they can also be spread of disease. The one that makes the news the most is West Nile virus, and that tends to, when it's reported in people, it tends to happen in August. I don't know why exactly. I know it may take up to a month to incubate, so people who were bitten in July finally become ill in August.
And what's the symptoms there to look out for?
Oh, it's fever, headache, weakness. You're very sick. It can range from mild, and I want to say also that one of the things that was discovered with West Nile is that a lot of people wound up being infected and had no idea they even had an infection. That was, again, is the studies done by the Centers for Disease Control for antibodies to West Nile, and they found that lots of people had been bitten by mosquitoes and they had an infection, and maybe they reported they just felt a little sick one day. It's most dangerous to elderly people and to people who already are in a weakened health condition.
And if people think they have it, if they obviously should go to their doctor, but if they can't go to their doctor, what are the public health options, or does the township even have any? Well,
for an individual, they should see their physician. As far as what the public health department is concerned about is control of mosquitoes.
Right, and you said it's standing water is the big culprit there?
Stagnant water is the culprit, and it's in hot weather. It can take only from 5 to 7 days for a mosquito to lay an egg in stagnant water, then it becomes a larva, then it becomes an adult flying, biting mosquito.
Now, what do you consider stagnant water? I mean, if you have a puddle in your lawn after it rains, is that stagnant water? Or
if the puddle dries up after a day or two, that's not a problem.
Right.
If the puddle stays wet for a week, then yes, that's a problem.
Okay. And you said there is a county mosquito control.
Yeah, Essex County does this fogging and spraying for mosquitoes, and I'll give you their number.
Yes.
Because they prefer to have the public contact them directdirectly. It gives them a better idea of where the problems are.
And what is that number?
It's 973-239-3366. and extension 2480.
And they'll come out and take care of it. Is there a charge, or is that?
No, there's no charge.
No charge.
They'll come out, investigate. They'll look for stagnant water sources. If their inspector, by their criteria, decides there's too many mosquitoes, they will come out, and sometimes they do hand backpacking fogging, and sometimes they come around in the middle of the night and they do some fogging, and you're probably not even aware of it.
Excellent.
They use a spray that's called ultralight mist. It's only poisonous to flying adult mosquitoes. Doesn't kill the other insects because of the time of day they spray, and by the morning when people are out and about, and other insects, including honeybees, are out and about, the poisonous part of the spray is already dissipated.
And obviously, if people are out, they should use repellent.
Yeah.
off
You
for
go
the
out at
mosquito
night,
repellent.
you should wear long sleeves, wear mosquito repellent. Yes.
Now, what else is on the health department? I know a couple months ago you had a report during the monthly meeting about some daycare centers.
Well, yes, daycare centers. We had,
but they were something that was taken care of.
Yeah, and apparently, and it wasn't just Maplewood, as I found out.
Right.
There were quite a few towns where there was an outbreak of what we call hand, foot, and mouth disease, and it's a common childhood illness. It's generally self-limited. It doesn't cause any lasting effect, and but the child can develop on their hands, feet, and in their mouth these boils. And the virus can be in the boils, or the virus can be in nasal secretions or in saliva, and that way it can spread to other children. So you can readily understand how in a daycare situation an illness like that could spread very rapidly. It's somewhat new to us seeing it in daycare centers as an outbreak, but now we had two daycares which had 30 to 50% of their children become ill with it within a week. So it was alarming, but fortunately the children got better very quickly. Our nurses went to the schools, went over all the sanitation procedures, contacted all the parents to advise them what to do as far as sanitation and what to look out for and how to care for their children. But we also found, since then I've been discussing this with other health officers in other towns, and it turns out we weren't the only town where it happened.
Okay.
So it was, for whatever reason this spring, there was Coxsackie virus. The virus is called Coxsackie virus. We had outbreaks at quite a few daycare centers in the state.
Okay. Any other business-related issues? Any businesses that have been shut down for health problems or concerns that people should know about? We're
always on the lookout for health code violations.
Right.
It's still house painting season.
Yes.
And so I'd like to remind people again that if you contract to have your house painted, make sure it's a house painter that knows how to do the lead-safe work precautions. And that's using the vacuum equipment with the HEPA-Vac, covering the ground, covering the windows, capturing as much of the dust and the chips as they can. The idea is to have a nice, clean job, and what they don't capture on the vacuum or the drop cloth needs to go back when you're done and clean up whatever is spilled around the perimeter of the house or the driveway or the porch.
And I know
the way childhood lead poisoning can occur.
Excellent. And I know if people have questions, what's the best number to call you in your office?
It's the town hall. I consider this one of our priorities because it's protecting children from being poisoned, and that's a role the local health department can fill.
And that best number is what?
The town hall number, 973-762-8120.
And that's extension 4400?
That's my direct extension, yes.
And then,
if I'm not in, leave me a message or leave it with someone else. I'll get it.
And also, how often, just for people's information, how often are food service locations inspected?
Well, at a minimum of once a year.
Right.
But then if we find problems or we get complaints, we inspect more often.
And if people find a problem, if they go into a place and they suspect something, they can call you at that same number?
Yes.
And alert?
Yes. And we do that fairly often.
Excellent.
So one of our priorities is to be responsive to resident complaints.
And I don't recall.
That's who we're here to serve, so that's who we respond to.
I don't recall any businesses recently shutting down because of health code.
No, I haven't had to close any food businesses for, I don't know, maybe a year now.
Excellent. And I
don't remember the last time right off the top of my head.
That's a good word. And I also mentioned that you and I were chatting at the Mayfest, and you always have people at the festivals, Maple Woodstock and 4th of July and all the other festivals, checking to make sure the food service is clean and up to par. I don't think most people realize that.
Yeah, we check with the vendors ahead of the fair to make sure that they know what the rules are, and then we have either myself or we have a part-time inspector who we go to the fair on the day of the fair and check the businesses to see if they're preparing their food in a sanitary manner.
Excellent. Again, we're talking to Robert Rowe, health officer for Maplewood. The last thing I want to ask is, it's only early August, but we all think, when do we get flu shots? And I personally am a big flu shot proponent, because a couple of years ago I got hit hard, and I had not gotten a flu shot for many years, and then after that I have done it since. So when do you start scheduling those? We've
already ordered our flu vaccine. We'll be having clinics, probably 2 clinics in October. If it turns out we need to do more, we'll do more. But one of the things that's happened, and maybe this would be interesting, is a lot of health providers are giving flu shots now. It used to be health departments and a few doctors gave flu shots, and maybe a few hospitals. But now almost all the doctors, certainly all the hospitals, now pharmacies, and even other businesses are giving flu shots at places of work. And so I see that as a good thing from a public health point of view, because more people are getting flu shots, and there's still a role for the health department, and we'll still be filling that role, but the trend is more and more people are going to other places to get flu shots rather than the health department.
Right.
And that's fine with us, because that means more people are getting flu shots.
Right. I think I got mine at Walgreens. So
yeah. Okay. That's
they're quick and easy, and insurance coverage. So it's.
Yeah.
But before October is not necessary.
I would. Flu season, I think, actually starts in September, but it can last until the springtime. So, in a sense, the so-called flu season is actually increasing in time.
Yeah.
And as you may recall, the H1N1 flu hit in June.
Right.
So it's almost like all year is flu season now. But having said that, the fall is still the time to get your flu shot.
And I guess as soon as
October, November, you could do it in December, you can do it December or January. If for some reason you don't get it earlier, it's still good to get it in January or even February.
So as soon as you have something available,
yes,
people should just get them, right?
Yes, as soon as the vaccine starts becoming available, which I think it will within the next few weeks. If you want to get your flu shot early, you can. If you want to wait till the fall, that's good too. Either way is fine.
Excellent. Well, thank you. Again, we're talking to Robert Rowe, the health officer from Maplewood Township. Lots of great information. Any questions, you can always call the Township Health Department, and obviously the Township about any other concerns. And hopefully we'll have only good, positive health news coming up. But if there's concerns, we always promote them and post them, and we thank you for all the information.
Okay, thank you.
Thank you, sir. Be well.